Okay, Assalamu alaikum. Let's talk about the management of anemia and all important clinical aspects related to the management of anemia. We all know that this condition is almost always there when you are dealing with patients suffering from end organ damage. Either they are suffering from chronic liver disease, chronic kidney disease, or chronic heart failure or COPD. And many persons coming to you starting from the children's to old age. This may look like a little derangement, but this can save a lot of effort by physician, and also it can detect earlier most of the sinister pathologies. And the most important one is colorectal carcinoma, and they say anemia in male patients is never a normal finding until you have a solid reason to explain the reason for anemia. And first we will talk about the general things about the anemia. What is the definition of anemia, what are the types of anemia, and what is the importance of knowing all this knowledge. And then we will talk specifically about the management of iron deficiency anemia. As we know that all over the world the most common etiology of anemia is iron deficiency anemia, and either they are adolescent children's or young females, they are suffering from anemia. And due to anemia there are grave consequences like delayed growth, growth retardation, and mental incapacitation, and then not achieving the good height, and many other things and many manifestations leading to the reduced quality of life. So that's why knowing each and every detail about the management of anemia is so important, that you can make a lot of difference even while working in periphery setting, while working in a tertiary care hospital. And this topic ranges from a simple just one drug leading to a good response till doing every investigation, not finding the cause and not making any difference, and you are not often able to even pick what is causing the anemia. So remember, anemia is not a diagnosis, it is often the manifestation. And the way we define anemia is by looking at hemoglobin most of the time. We will discuss about the other ways to define anemia. So first let's now talk in detail why it is important to know by heart this disease. I already have talked about that anemia is so prevalent, and every gender, every race, and many of the patients suffering from many other diseases, they also have anemia at the same time. Sometimes anemia may not be the sole reason for coming to you, or sometimes it may be the primary reason for consulting a doctor. It depends upon the setting where you are facing the patient. Or for example, while working in a periphery setting like in VHU or DHQ, THQ, females or children will come to you by complaining that I often feel tired, or I am not able to do my work that I was able to perform earlier, and now I am experiencing shortness of breath. All those symptoms you just can explain them by keeping in mind that you don't have enough oxygen level to supply the power to every part of your organs, starting from the brain till your legs. Like if you are not getting good oxygenation by the due to reduction of hemoglobin, then you will feel obtunded or confused or not able to think clearly. Then the same goes with your muscles, that you feel tired, myalgias are there, fatigue is there. And then having the manifestation of anemia on heart is by shortness of breath, and the same is that other parts of the body will experience the same manifestation. So there is no fun in explaining what are the symptoms of anemia. What we are trying to establish or make emphasis on is, it is important to make sure that you find the cause of anemia and what is causing the anemia. So to know what is causing the anemia, you have to think that anemia itself is not a disease. It is often caused by many other underlying reasons. So what I just have told, that anemia is not a disease itself, it's often a manifestation. Like iron deficiency is leading to anemia, or B12 or folic acid deficiency is leading to anemia. And next thing, how you define anemia? It is simple reduction of hemoglobin less than the reference value when looking looking at the age, gender and race specific values, and the values most often people explain anemia is by hemoglobin levels, and hemoglobin most of the time is often referenced as 11 to 14 or 12 to 16 gram per deciliter or milligram per liter or like this. Remember, there are some conditions in which you can see a little bit overestimation of the HB values and underestimation of the HB values. Do read more about this and always think of variation in normal physiological parameters, like when you are dehydrated you will see the HB is little bit more than the actual value, and when you are suffering from overload states like when the female is pregnant in third trimester, then you will see a delusional anemia, and that is actually not an anemia. Remember this as well. Always classify anemia based upon the MCV, because this one is the most important to tell you about the what next investigation can help you in making or reaching the diagnosis of the underlying cause of the anemia. So having a sound knowledge is often going to cut short your journey till you make the diagnosis. It is indirect way of saying that you will decrease the suffering of the patient, you will decrease the expenditures of the patient, and this way you will make a big difference. And whatever classification you use, the important thing when using the severity classification is it can guide you about the management outside the hospital or inside the hospital, and also the severity is somewhat associated with the usage of the appropriate agents like oral versus iron, or you can say use of blood products. And the most practical way of classifying anemia is based upon the MCV, that is microcytic, macrocytic and normocytic anemias. And you know that the three most important reasons for having microcytic anemia is iron deficiency, thalassemia and anemia of chronic disease, on which some books do have some reservation that this may be a normocytic anemia, but still remember iron deficiency anemia is the most commonest one that presents with low MCV. And the low MCV, by low MCV we can say that it is often less than 72 femtoliter. There is a little bit variation in different laboratory values, but you can have an estimate that this is low MCV. Now, the anemia in few population is never a normal finding. I already have told that whenever you see anemia in patients of old age, try hard to find the cause. So anemia in an old male is never normal finding, because it can be the onset of colorectal carcinoma, or it can also never be a normal finding in postmenopausal female. There are other populations as well, but still a general statement is that, for example, a young menstruating female with not having good enough nutrition can make sense, but once you have everything required for the production of hemoglobin and still you are having anemia, then this is not a normal thing. But still, don't take it just a casual finding, or don't ignore it on a complete blood picture report. Try hard, try to have the surety that what is the reason of anemia. Throughout my 10 to 11 years, I have seen that you find this simple derangement in 60 to 70% patients once they are here in hospital, and once they are in tertiary care hospitals they are having more chances of having at least anemia. And the earlier you have more suspicion that there can be a sinister pathology, the more good results you will achieve. Now, coming to the management, after talking about why it is important and how to make sure that what is the reason of anemia and the way of diagnosing anemia and general statements. Now, thing is, always look for underlying cause. Once there is anemia, have a look at MCV, then try to make an estimate, get some clues from the history, get some clues from the other values. For example, on a complete blood cell report you are having pancytopenia, then the clue is that this patient may have hematological malignancy. causing the underproduction or lack of production of hemoglobin. And important thing is also that once you have hematological malignancy, the reason for anemia is it comes late. It comes later than the deficiency of other blood products. For example, platelets having less half-life as compared to hemoglobin. So now coming on the next important thing is that rule out celiac and menorrhagia first, and especially think of celiac disease as a cause of anemia once the patient is also having some history of diarrhea. And females often don't have good enough knowledge about what is actually the definition of menorrhagia. So go in detail, ask them about how many number of pads they use for their menstrual cycles, and do refer them to gynecology and gynecologist, and let them have investigations about this. And the other causes of anemia are a chronic blood loss going on either by worm infestation that are sucking the blood, or a person who is having melena, cult blood that is not visible but still the bleed is going on, or anyone who is suffering from peptic ulcer disease and the blood is oozing out, and the chronic liver disease where still the cause of anemia here is also more loss, and that the production is not able to meet that loss. And one practical tip, that is give them deworm therapy, or you can say give them Vermox, albendazole and mebendazole. That is going to save a lot of time, especially in children. We have seen many patients coming with different complaints, and but still we often find the worms moving inside the colon. So here in countries like Pakistan, Bangladesh, India, the parasitic infections are so prevalent that giving a trial or empiric therapy of parasitic deworm therapy is always going to help you once you think that it is appropriate. Specifically talking in the context of iron deficiency anemia, it is so important that don't discontinue therapy too early. Let me give you an example and to explain it a little bit further. That for example, we as a person have some money in our pockets, and we also have some reserves in our banks. We are technically not short of money until we consume all the money present inside a bank. So same is the story, that once you have a anemia that is present, so it means the iron stores are already depleted from the reticuloendothelial system, and all other storages are also gone. So now you don't just have to correct the HB, you also have to replace all the stores. So it takes 3 to 6 months, but people don't take therapy often that long, and they discontinue in between. Make sure that either you first get the level of iron or order iron studies before starting therapy, and then checking it again. Don't just discontinue therapy once you have normal HB. So one important mistake I also want to share during the whole course of the management of anemia is that we often treat empirically without proving the cause of anemia, and that's often being mispracticed everywhere, starting from the bottom to the very high specialized hospitals. So don't do this mistake whenever possible, and the circumstances allow you to. Make sure that you have all the required tests. So make sure that the cause of anemia is iron deficiency or folic acid deficiency or B12 deficiency, because once you are not having good responses or the HB is not increasing, so believe me that you are in trouble. Because now if you send the laboratory tests, the tests are not an actual reflection of your HB levels, and especially once the patient have just gone through any blood transfusion, then also the blood picture become deranged, and you don't get what is actually the reason of anemia, and this becomes difficult to manage. So remember, before you transfuse blood, take a sample for all the required tests, and also make a habit that whenever the circumstances and the finances allow you to get the iron studies, folic acid, B12, whatever required, by looking at the clues of the underlying cause. So now, choosing the appropriate therapy when managing the iron deficiency anemia is one of the key things that an experienced clinician have mastered. That you know that the patient is not going to take oral because of the reasons, then you have to go with IV iron. And once you know that there is no indication of IV, do tell them that you have to take the oral therapy for longer time because of the reasons that it is easier to take, it is easier to take, it is cheap, and having less side effects, or you can say less serious side effects. So the things that stop a person from choosing oral therapy is often the females complain that after taking the oral pills, I feel nauseous, I feel nausea, vomiting, or having some GI side effects. And this one thing limits a lot of oral intake. And among the oral agents, there are some different forms of iron that have some advantages over another. Here I would like to make a point that I have often seen that the females coming to us and asking for the venofer infusion, that is one of the form of IV iron, that I am here to because my doctor advised me to get this infusion, and they get one transfusion and then they forget, and they think that the anemia is going to be all right. This is not right, because once you have selected the IV iron for the correction of your iron stores, then you have to calculate the exact dose of IV iron required to fulfill all these depleted stores. Let's summarize. Anemia not responding to treatment is often celiac disease. By what is mean by this anemia not responding? For example, you ordered a CBC test and there was deficiency of hemoglobin and the MCB was low, or you came to a conclusion that the patient is also having diarrhea, and you think that the cause of anemia is celiac disease. One way to reach to the diagnosis of celiac disease is this simple approach. The other way around is, once you are treating a patient with iron deficiency anemia, but the patient, in spite of having appropriate dosage of iron, still not having increased level of HB. So this is what I want to say, that once you have anemia and that is not responding, think of celiac disease. And the other way is, or the other cause of a situation like this is infection by H. pylori organism. Dietary modifications and lifestyle modifications are all that important, because all those who cannot afford iron therapies, they can improve a lot by just the modifications, or you can say added benefits of modifications in diet and lifestyle are also going to make a big difference. What are those dietary modifications? And that is increased intake of iron rich diets. And the diets rich in iron, you can find them on internet. Meat is one of the iron rich diet in which that is readily absorbable. The vegetable sources of iron are not easily absorbable. That's why having the eggs and meat in the diet of a children or the adolescent can make a lot of difference. And then the other lifestyle modification that can help is not using too much herbal teas, and coffee or caffeine often obstructs the absorption of iron. just a little bit information about the oral iron forms and the practically available agents in market. Are most famous ones are the Spensul, Fifolvit, the a little bit different form of a capsule in which you see some granules is Spensul. Fifolvit is often present in basic health units where people come and demand that we want that small capsule to increase their iron stores as advised by their gynecologist. And hybrid folic, the most efficacious product regarding iron. We also have seen our seniors using this. And then the bisleri is a different form, that is iron polymaltose complex. So oral forms are different preparation for ferrous fumarate, ferrous gluconate and ferrous sulfate. But the important thing is, once the patient is having GI side effects, then try to use iron polymaltose complex, that is bisleri, because it has less GI side effects as compared to other forms, ferrous or ferric, and they may have some relief of their GI side effects. So once the patient is on oral iron and taking it from a longer time, but still the anemia is not improving, or the improvement if of anemia is causing more troubles by side effects as compared to the improvements in daily life, then think of something else, or think of some other therapies, and that is the indication of IV iron. Now let's talk about the IV iron. And that IV iron, there are different forms of IV iron. That important ones are the iron dextran, iron sucrose, and these two are the most commonly used one. But nowadays we know for iron sucrose is the most frequently used one.